Schizophrenia is primarily a disorder of A. Thought and perception, B. Motor function, C. Intelligence, B. Personality. Correct answer? A. Thought and perception. The hallmark symptom of psychosis is A. Fever, B. Loss of contact with reality, C. Fatigue, D. Tremor. Correct answer? B. Loss of contact with reality. Which of the following is a negative symptom of schizophrenia? A. Delusion, B. Hallucination, C. Avolition, D. Disorganized speech. Correct answer? C. Avolition. The most common type of hallucination in schizophrenia is A. Visual, B. Auditory, C. Tactile, D. Olfactory. Correct answer? B. Auditory. Which term refers to a false, fixed belief not based in reality? A. Delusion, B. Hallucination, C. Confusion, D. Paranoia. Correct answer? A. Delusion. Which phase of schizophrenia is characterized by social withdrawal and odd behavior before active symptoms appear? A. Acute phase, B. Remission phase, C. Residual phase, D. Prodromal phase. Correct answer, D. Prodromal phase. The term alogia means A. Lack of motivation, B. Poverty of speech, C. Loss of pleasure, D. Impaired attention. Correct answer, B. Poverty of speech. The duration for diagnosing schizophrenia is at least A. 1 week, B. 1 month, C. 3 months, D. 6 months. Correct answer, D. 6 months. The first-generation typical antipsychotic drug is A. Risperidone, B. Clozapine, C. Haloperidol, D. Olanzapine. Correct answer? C. Haloperidol. Avolition refers to A. Lack of pleasure, B. Lack of motivation, C. Disorganized speech, D. False beliefs. Correct answer? B. Lack of motivation. A nurse observes that a patient repeats words the nurse says. This is known as A. Echolalia, B. Echopraxia, C. Perseveration, D. Clang association. Correct answer, A. Echolalia. In schizophrenia, flat affect means A. Mood swings, B. Lack of emotional expression, C. Crying frequently, D. Euphoria. Correct answer, B. Lack of emotional expression. Which type of schizophrenia shows disorganized behavior and inappropriate laughter? A. Paranoid, B. Catatonic, C. Disorganized, D. Undifferentiated. Correct answer, C. Disorganized. A patient copying the nurse's movements is exhibiting A. Echopraxia, B. Echolalia, C. Perseveration, D. Mannerism. Correct answer, A. Echopraxia. Which of the following best describes delusional disorder? A. Hallucinations dominate, B. Mood swings, C. Memory loss and confusion, D. Fixed false beliefs with normal functioning. Correct answer, D. Fixed false beliefs with normal functioning. The nurse notes the patient believes insects are crawling under the skin. This is A. Visual hallucination, B. Tactile hallucination, C. Auditory hallucination, D. Somatic delusion. Correct answer, B. Tactile hallucination. A patient who suddenly develops psychotic symptoms lasting less than 1 month is diagnosed with A. Brief psychotic disorder. B. Schizoaffective disorder. C. Schizophrenic disorder. D. Delusional disorder. Correct answer: A. Brief psychotic disorder. I am the king of the world. This statement shows A. Persecutory delusion. B. Grandiose delusion. C. Nihilistic delusion. D. Somatic delusion. Correct answer: B. Grandiose delusion. Anhedonia refers to A. Loss of pleasure. B. Lack of motivation. C. Poor attention. D. Loss of memory. Correct answer: A. Loss of pleasure. The nurse's primary role in caring for a psychotic patient is to A. Enforce medication. B. Establish a therapeutic relationship. C. Provide food. D. Arrange discharge. Correct answer: B. Establish a therapeutic relationship. Which symptom is most characteristic of a depressive episode? A. Flight of ideas. B. Grandiose thinking. C. Persistent sadness and hopelessness. D. Excessive talking. Correct answer: C. Persistent sadness and hopelessness. Which statement best describes a manic episode? A. Period of severe sadness and low energy. B. State of elevated or irritable mood with increased activity. C. State of confusion and disorientation. Or D. Period of emotional flatness. Correct answer: B. State of elevated or irritable mood with increased activity. Which type of psychosis has no identifiable physical or organic cause? A. Organic psychosis. B. Induced psychosis. C. Secondary psychosis. D. Functional psychosis. Correct answer: D. Functional psychosis. What is the primary feature that distinguishes psychosis from other mental disorders? A. Presence of anxiety and fear. B. Loss of contact with reality. C. Emotional instability. Or D. Personality disturbance. Correct answer: B. Loss of contact with reality. The best description of a catatonic patient is A. Always laughing. B. Aggressive and talkative. C. Immobile or showing bizarre postures. Or D. Overly social. Correct answer: C. Immobile or showing bizarre postures. The neurotransmitter most implicated in schizophrenia is A. Dopamine. B. Acetylcholine. C. Histamine. D. Gamma-aminobutyric acid. Correct answer: A. Dopamine. Holding an unusual posture for a long time is called A. Negativism. B. Echopraxia. C. Catalepsy. D. Compulsion. Correct answer: C. Catalepsy. An example of somatic delusion is A. My body is rotting inside. B. I am the president. C. The police are following me. Or D. God is speaking through me. Correct answer: A. My body is rotting inside. The most appropriate nursing diagnosis for a client hearing voices is A. Anxiety. B. Disturbed sensory perception. C. Social isolation. Or D. Ineffective coping. Correct answer: B. Disturbed sensory perception. A patient shows both psychotic and mood disorder symptoms. The likely diagnosis is A. Schizoaffective disorder. B. Bipolar disorder. C. Catatonia. D. Personality disorder. Correct answer: A. Schizoaffective disorder.
How many questions did you get correctly? Drop your score in the comments section. If you found this video helpful, don't forget to like, share, and subscribe for more nursing and NCLEX questions.